morning, everyone. I think we will kind of give the audience another maybe 3 minutes, and then we start.
Yeah, we have plenty of time, no worry.
I hope everyone get a chance to collect the goodie bags already, perhaps. There's some kind of fantastic products in there, so please do get your goodie bags.
Can we get double?
Can definitely, most definitely. หมอมีถุงพิเศษอยู่กับน้องกับน้องครับครับผมได้ครับ
สีชมพูกับสีน้ำเงินต่างกันยังไงวะแต่น้ำเงินน่ะซ่อมผิวแบรีเออร์
ใช่ถูกต้องครับแล้วก็สีฟูจะเป็นเมลาซ่าครับ
วันนี้เราจะพูดสองอย่างใช่ไหม
ใช่ครับ
และทั้งสองอย่างจะมีไอเกรดโพสูง
ถูกต้องใช่คือพูดสองอย่างแต่ว่า 70% จะอยู่กับสีฟู 30% นิดๆจะอยู่กับสี
ช่วงไอเกรดโพสูงเทคโนโลยี
วิทยาศาสตร์ครับผมใช่อันนี้ก็สุดคุณหมอพูดได้นะครับเขียนเป็นภาษา
ผมผู้สูงครับผมรู้สึกว่าตัวเองสเตรส
เขียนมาในส่วนของกราฟจำไม่ได้
เราพูดไปเลยเดี๋ยวเขาก็ปิดเอง
Good morning again, everyone. I think it's now a good time to start. First of all, good morning and perhaps สวัสดีครับนะครับก็ welcome everyone of you here to this kind of what we think will be a very interesting scientific sessions to start Teamcast Asia 2026 on your Friday morning. It's a bit an early start for a kind of a scientific talk, but I hope this session is going to be an interesting one. That's right. We think that this session is going to be very interesting, not only to dermatologists, which we have in the room here with us today, but also for the kind of everyone out there who is interested in seeing where the science in skincare is heading.
And also ourselves. After I heard the products, I think that it is very interesting to use, even for myself. And so I go back and gonna use it.
So for the next 40 minutes, let's say, right, we're going to take you on a journey that begins deep within the skin cells and then ending with a technology. Right? We think it's really will be a kind of a groundbreaking technology when it comes to something that will be effectively address the skin issues in terms of the sun-induced melasma and the barrier damage. That's right. And the name of the technology is glycosome. That's right. So we hope that by the time once we finished, you'll get a sense of what glycosome actually is, what it does, and more importantly, how it is kind of fundamentally different from other skincare technologies that you've seen before. Right.
So and shall we start?
Yeah. Yes.
Okay. So let's introduce ourselves. I'm Dr. Wasanop Wachiramon, a dermatologist working in Bangkok, Thailand.
Myself, my name is Anushai Sinsawat. I'm part of the Vaseline Global Research and Development based here in Bangkok.
Okay, actually, you are not the part, you are the leader in R&D. This is our great honor to have you here, actually, because, you know, we heard a lot of Vaseline products in the market, and actually, he is the person behind of those advancing technologies for Vaseline. So I think we are very happy that we have you here in this room. So the content of our talk today is the first part, it's going to be covered by me. So I will talk about the melasma that actually everyone knows already about melasma, but there are some points that some of you might not know that I will go into the detail. So I will take you through the detail of the unknown part of melasma. And what is your role today?
Yes. And after that, so myself, I'm going to talk about the glycosome technology from Vaseline, the newest technology that we have. And we talked about the thinking behind the technology, how the technology was engineered, and once again, how the technology is fundamentally different from the rest of the skincare technologies that we've seen before, right? In terms of addressing both pigmentation problem and barrier problem at the same time.
All right, so shall we start? Well, you know what, actually, we know that sun exposure creates lots of damage, even though we know that we have to expose to the sun a little bit because we want our bodies to synthesize vitamin D. But I mean, if a lot, we can have a problems. And then it's not just you have skin darkening. There's lots of issues. You know, we have skin cancers, we have aging. And that means we have to do something with the insult from the sun exposures. And let's take a look at this. If you look at the left graph, UV can initiate reactive oxygen species in the skin that you can see with the presence of UV, especially UVB. You can see higher degree of reactive oxygen species in the skin, and also not only UVB, actually UVA, and there are lots of things. But just want to show you that not only the pigment overproduction that represent in the middle graph, but what you have to know is on the right side. You can create a lipid peroxidation in the skin cells, and that is you're gonna have compromised skin barriers. So most of the time we know that when we have compromised barrier, most of the time it is because of we have rash, we did the derm abrasion, or we did the strong laser to destroy our epidermal. But actually just UV itself that can create lipid peroxidation in the keratinocyte. You can create loss of skin barrier. That means you can weaken your skin. And then what to do? You know that when you expose to UVB a lot, especially in susceptible patients, you can have the melasma. Those who have family history, for example, even though today you don't have melasma, but if you keep exposing to the UVB and you have the family history of melasma, you are the one who prone to have melasma, because nowadays we can identify lots of genetics. We have many candidate genes nowadays that identify in patients who are susceptible to melasma. So this is something that it can trigger to our skin. And there are so many times that we are focusing on sunscreen and sun protection. But what we overlook is that we forget about the skin barrier disruption. And not so many people that talking about this much. That's why I think this is the issue that we kind of have to think of and also pay attention to. So let's take a look at this one. Melasma, we know that this is the recurrent condition that you can have pigmentation, and then you have, like, you treat. For example, your patients come into your office, and I think many of you do the pico laser or other aesthetic procedure to try to eradicate the excess pigment. And this is the thing that patients said, oh, I'm getting better after a few courses of pico laser treatment. And then about 3 months after, they said, hey, why condition is coming back even though I try to do a very good sun protection? And this is because of you forget to repair your barriers. Because if you don't repair your barriers, the condition can come back. And then this have to think that you have to know, because we have free radicals in the skin, and sunlight can create this excess free radical. And that's why not only we have to treat with the excess pigment, either with the laser, either with the lightening agents, not only we have to do the UV sunscreen, but also we have to fix with these free radicals, and also we have to repair the barriers. That's why we have to pay attention to this part. And that's why this is not the pigment issue. And there are something that we discovered during the recent years, that there are so many changes in the dermis. You know that not only excess melanin in the basal layer of the skin, But in the dermis, you have solar elastosis, you have increased mast cells, you have low-grade inflammation, you have pendulous melanocyte, you have melanophage, you have increased vasculature. So this is the dermal change, and nowadays we try to do something to fix our dermal compartment, and also we fix the excess pigment, but think of the upper part of the epidermis, which is the epidermal cells and stratum corneum. Please pay attention to this issue as well. Else, when your melasma improve, it's gonna come back again if you don't fix this issue. This is something that we want to focus on. And this is the facts about the barrier, especially in Asian skin. We know that in every single patient, especially Asian, we have thinner, Asian patients have thinner stratum corneum when compared to the rest. And that's why we have to fix the stratum corneum. And if our stratum corneum is become stronger, then your skin will be tolerate more on sunlight. So not only the sun protection, but you have to fix your stratum corneum. This is the thing. And you know that when we have melasma, there are some evidence show that you have impaired lipid barriers of the stratum corneum. And another thing that you might want to think of is the basal membrane. Basement membrane disruption is another thing that happen in the skin lesion of the melasma. So that's why there are many procedures that you try to target the basal layers of the skin because you want to fix the basal membrane. And treatment in Asian is quite challenged, not only because of we are in the tropical country, and also we have darker skin type. That's why our melanocyte is quite more active when compared to the rest. So we are quite prone to have melasma as well, and also genetics, right? And when we do aggressive treatment, sometimes you go with too aggressive parameter or laser. Then the condition getting worse, melasma getting worse. It is because of you create inflammation, too much inflammation, you can have active melanocyte more. So sometimes when I go with laser treatment on my patients, sometimes I don't go too high setting. Else you're gonna create another hyperpigmentary issue on top of that melasma lesions. And that's why your patient come and said, after doing few sessions of laser, why my skin getting worse? Then you have to think of this. And also, like what I mentioned previously, that stratum corneum, especially in Asian skin, is thinner. Then you have more prone to develop hyperpigmentation on top of the melasma lesions. So that's why we have to fix the stratum corneum. And this comes to the technologies that Kun Anushai that he develops as a part of UNILEVER, that he tried to help us to fix this part, because not any cream can help us. You have to be focusing on the repair your stratum corneum as well. And this is the lipid peroxidation graph. Kun you have the data on this? Yeah, you can see that when you kind of like most exposed to the UVB, then when the time passes by, you got more and more lipid peroxidation in the skin. And also you can see the middle one, you can see the increased transepidermal water loss after you increase the dose of UVB, and also when you expose to for a longer period of time. And on the right side, you have like ceramides content in the skin, right? We have more than 10 types of ceramide in the skin. And there are some types of ceramide, and including the total ceramide, that significantly reduce in melasma lesions. So not so many studies mention about the ceramide contents in the melasma skin. So that's why we have to fix the ceramide and also the stratum corneum issue in melasma patient. Else, the melasma improve after your procedural treatment, but it can come back within the next few months if you don't do the good sun protection, if you don't fix the stratum corneum barrier. So that's why the UNILEVER team helped us to create something, some innovative some innovations that can help us to practice and work with the melasma patients. Yes, so you have any technology to introduce to them?
Yes. So basically, just to do like a quick recap, right? So the number one, the most important thing is about the oxidative stress. So one, root cause, two, consequences in terms of the pigmentary disorder and barrier disruption. So that's the kind of the first point that we want to learn. And the second point is about melasma itself. So the conventional thinking about melasma is that it's all about pigmentary issues, right, alone, right? But to be fair, as Kunmor was saying earlier, that it's about barrier disruptions as well.
It's not pigmentary issue alone. We talk about this many years already. It's about dermal issue.
Yeah.
We also talk about this during the past recent year. But we don't talk a lot about stratum corneum. So that's why I think this is something that we have to talk more.
And the part about the stratum corneum disruptions, right? I think this is one of the key reasons to why melasma is a recurring skin issue, right? It's really, really difficult to treat because it always comes back. Because when you fixed the pigmentary disorder alone, right, you still leave out the other part of the melasma has not been addressed, and therefore you need to fix both. And that's why we have the glycosome technology from Vaseline to do that job, right? So.
Okay, glycosome technologies, I think we are very interesting. If you look at the blue and the pink, can you kind of do some introduction a little bit? What are the difference between the blue and the pink products?
Yeah. So basically, if you look at the Vaseline Prodoma face care range, the new range, we have the pink variants, let's say, and we have the blue variants, right?
Blue is for barrier repair.
That's correct.
But the pink is what?
The pink is more targeting towards the pigmentation issue. Right?
Pigmentation
about
issue.
Melasma, sun-induced melasma problem.
So for example, if I have melasma, would you recommend me to apply the pink or the blue?
If a patient has a melasma problems, then the recommendation would be to use the pink variant.
Mm-hmm. But if they have like a remission from melasma, do you still recommend the pink or you recommend the blue?
Maybe the blue one.
Huh?
maybe
both. Maybe both. Apply everything. Since we still have to maintain our melanocyte not to be so active, sometimes we have to go with
the glycosome technology actually sits in both range.
Both range.
So all flow products got glycosome technologies, right? But for the pink ones, there will be extra ingredients in the products to boost additional benefits towards the pigment.
Okay. So I think we should focus on the glycosome, your technologies.
So basically, glycosome, what is glycosome, right? It's the kind of a Vaseline topical precursor technology, right?
Newest topical precursor technologies to address hyperpigmentation and barrier damage.
And barrier repair at the same time. So okay. That's the key words, right? And then perhaps there's a QR code so that you can scan and learn more about what glycosome technology actually is. Okay.
Yeah. But before we go back and read, we should listen to the history, right,
yes.
of the glycosome.
Yes. So a quick history of how we arrived at the glycosome technology is right. So the technology did not just appear on a blank sheet of paper. Basically, it's a technology that based on years and years of understandings around the skin science, barrier science, and in precursors themselves. Right? Mm-hmm. So if you look here, starting in 1974, when a team of the scientists from UNILEVER actually discovered the importance of free fatty acids to maintain the skin barrier integrity.
Okay, right? You born on that year already?
Somewhere around there.
Okay.
Yeah. And subsequently from there, right, we learned to realize that by kind of supplying ingredients topically, let's say for example, ceramides, right, it was not a kind of a most effective approach out there because the sheer size of ceramides making the ingredients very difficult to penetrate, right, which means that the bioavailability of the ingredients to the skin cells is very, very low, right? And then we thought about how do we overcome that challenge, and therefore came about the bio precursor approach. Right? what actually is the bioprecursor approach? So bioprecursor approach is pretty much the kind of a smaller building blocks of the ingredients that can penetrate the skin very effectively. Skin can use those bioprecursor, right, to produce the ingredients that they need. So, for example, the precursor of ceramides could be like short-chain fatty acids. Precursor of glutathione would be amino acids, for example.
Yeah.
So those are the kind of the thinking behind how we arrived at the glycosome.
So glycosome is, what you try to say is like, glycosome is not ceramide. You know there are so many products in the market that supply the ceramide in the skin, right? But glycosome itself is not ceramide, but it is like pre-ceramide, right? That when you apply this agent, this technology, and then your skin cells will be able to produce ceramide. Yes. Then I think it is a good idea because, you know, let me go back to this one. You see on the right side, we have so many ceramides in the skin. And then there are so many products in the market that they said like they have ceramide 1, ceramide 3, ceramide 9, for example. So actually, but this nomenclature is a different system, but if you translate to the number, then you're gonna know the number. By the way, so if you want to supplement the ceramide in the skin with the ceramide itself, then you need to have like ceramide 1, 2, 3, 4, 5 in the bottles, which means that it's gonna be too expensive, right? And that's why not so many products can put so many ceramides in their finished product. They have to put like just 136, the essential ceramide, for example.
136.
Yeah. But with the glycosome, you are able to produce every single types of ceramide. Am I understand correctly?
That's correct. So basically, the kind of a precursor approach, right, with the glycosome, you're actually producing 9 out of 12 of the essential ceramides in your skin.
Okay,
right?
so you boost up 9 types of ceramide. So this is the key message that you want to deliver to the patients because glycosome can induce your skin to synthesize the ceramide, 9 types of ceramides. So can you elaborate more on this?
So this is to kind of explain a little bit more details what glycosome actually is. Once again, it's the bioprecursor, that's right. It's tiny building blocks of different molecules combined, that's right. And what it does is that once the glycosome gets absorbed into your skin, it can boost the internal synthesis of the ceramides, hyaluronic acid, as well as the glutathione, which is the antioxidant defense.
And also you said that in this presentation, rather than targeting superficial skin issue alone, glycosome targets multifactorial natures of skin damage. So means that, what does it mean? So not only boost the skin ceramide, also glycosome can enhance antioxidant defense. That's correct. In the skin. Yes. And also can increase HA synthesis in the skin as well. That's correct. So not only just boost up the ceramide. Yes. So this is your patent technology, right? Patent from Unilever. Okay.
So like Dr. Pasno was saying, right? So the key part or the cornerstone thinking about kind of glycosomes is that first you have to address the oxidative stress, right? So that's the upstream kind of issue that happens in your skin. The downstream consequences of exposing your skin to the oxidative stress are things like disruptive skin barrier and then the hyperpigmentation, right? So upstream and downstream kind of thinking is the cornerstones of why we designed the glycosomes, right? Once you kind of get rid of the upstream oxidative stress, then the downstream's benefit in terms of strengthened skin barrier, lower pigment in your skin would come naturally, basically. And this is like a quick kind of data of the glycosome.
Okay. So if we look at the right diagram, the control group, the cell is the keratinocyte, right? And you can have like the oxidative stress. So when you treat with the glycosomes, you reduce the ROS activities.
So yes, so this is like the results that look at one of the 2 legs of the benefits of the glycosome, which is on the antioxidant, basically, right? So you see that when you kind of apply the glycosome into the product, or in this case, in the keratinocyte, you see that you see like 33% reductions of the ROS, which
Okay.
is the free radicals compared.
You mean the pink one?
Yes, the pink one.
The pink graph?
With that.
UVB versus UVB plus glycosome.
Yes. Yeah.
So the yellow, the orange when compared to the pink, you got more reduction.
Yes.
Okay.
And the right-hand side is just the kind of a quick kind of animations of the glycosome in action, so to speak. So this is the fluorescent skin cells. So basically, what you see is that for the cells that's been exposed to the UVB, right, you see the cells are lit up with the green rings outside. So that's the free radicals.
More fluorescent staining.
That's correct. And then for the ones that's been kind of treated with the glycosome, the kind of the colors or the fluorescence are much.
So your cells is more quiet, more calming.
Yes. So this is like a real kind of result to illustrate that glycosome does have the ability to neutralize free radicals in the skin cells.
Okay. And what about this?
For this one here, it's the highlights the oxidative benefits of the glycosome on the skin cells and the skin model. So we see that once again, it's difficult to point.
You want to point out?
It's okay.
Yeah.
So once again, when you kind of neutralize the free radicals, right? So these are pretty much the kind of like a downstream end benefits that you get by neutralizing the oxidative stress. So you get the benefits on the melanin production. So basically, you see the reduce in the melanins from using the glycosome. So that's the left graphs.
The left graph, the gray is non-treated area, and the yellow is UVB.
That's correct. So those are the skin cells that have been challenged with UVB. You see that.
You can see more pigmentation.
Yes, pigment increase. And then once you apply the glycosomes, it actually reduces the pigments.
Okay.
Right? And then on the right-hand side is the other leg of the benefits of the glycosomes, right? Which is on the barrier repair, basically.
Okay.
Right? From there, you see that glycosome has the ability to enhance three key kind of proteins in your skin.
In the skin.
Yep.
So what I try to say is that actually most of the time when we see the graph from the products from many we think that lightening agent, for example, lightening agent can reduce the pigment, the excess pigment. But glycosome itself is not lightening agent. It just boosts the barrier, repair the oxidative stress in the skin, and also the increased skin produce more HA, which actually nothing to do with the melanin pigment system, but you can see that you get like indirect effect from the glycosome that then helps our practice to deal with the melasma patient. So I think this is something that we can incorporate into our practice. I wish I like it because we do lots of procedures, and then your products can help us a lot in terms of this, and especially the right side that you can see the enhancement of the proteins, the skin barrier proteins, the stratum corneum component that make our skin more strengthened.
From the previous charts, right, we learned that glycosome does have the benefits on the pigmentation and the barrier repair, right? On the next slide, so we're going to go first, have a look at the first leg, which is about the pigmentation problem.
New Vaseline Proderma Melasma Repair.
When you only treat it at the surface, unfortunately, melasma will come back.
Hi, I'm Dr. Hadley King. I'm a U.S. board-certified dermatologist.
Introducing Vaseline's first ever face care innovation inspired by exosomes. Proprietary glycosome combines with niaglutamide and SPF 50+ to prevent and reverse melasma at all 4 stages by 85%. Reclaim your skin radiance. New Vaseline Proderma Face Care.
ครับ So if you look at the proderma phase, the first leg about pigmentation, so these are the four kind of benefits on the pigmentation pathway, right? How it reacts, right? So when we zoom into how glycosome actually works towards the pigmentation problems, right? You will see that it's not a single mechanism. So actually, they actually try to address the pigmentation problem through different mode of actions, basically. The first one, the most important one, is once again, we are trying to kind of get rid of the upstream trigger, which is the free radicals, right? So that's number one. Glycosome has the ability to neutralize the free radicals in your skin, right? And from that, what decides that the technology also has this mineralophagy kind of benefits, right? What decides is that it destroys, right, mineralosomes, right, before the pigment gets transferred upwards to the surface of the skin. So essentially what it does is that it kind of reduce the pigment payload before it's become apparent on top of the skin.
Okay.
Yeah. And number three, it also helps reduce the visible melasma through the process called the phenolmelanin switch. So what it does is that the technology bias or nudge the process of the melanogenesis towards the lighter melanin color, and therefore kind of prevent the kind of the color of the pigment to become apparent on top of the skin.
Okay.
The last part, of course, the last bit is on the down-regulating the tyrosine enzyme, so therefore preventing the future dark spots.
So the pink products that you introduced, not only you incorporate the glycosome technology, but did you incorporate any lightening agents?
So on top of the glycosomes, right, on
in this pink product.
the pink brand,
Yeah.
it's got ingredients like niacinamide in that as well.
You incorporate niacinamide.
That's correct.
Okay. And what is this? What is about this graph?
This is pretty much the result of the finished products, right? So previously, when we looked at the results, right, those are from the technology itself, and this one here is the full formula, right? You see that once again, the serums that contains the glycosome technology has the ability to reduce the melanin by as much as 36% and increase the skin brightness in terms of the outstar by 10%.
Okay. So you did like mechanism. You addressed many mechanisms.
Yes.
And this, what about this? When you combine with UV protection.
That's correct. Because we understand that, I mean, if we look at the, if we focus on our regions, right, Southeast Asia regions, right, the UV index is extremely high. And therefore, using the SPF protection is always recommended, right? And from what we've learned is that when you combine the glycosome technology with the SPF protection, right, you actually enhanced or increased the overall performance of the formula, right? You see on the left-hand side, you see that when you combine glycosome with the product with the SPF protection efficacies, right, you get 18% boost in performance on the melanin.
So you enhance benefit.
Yep.
With you, if you combine with sunscreen,
That's
and
right.
especially we have to combine sunscreen in our practice, of course, for melasma treatment. And the brightness, look at the right side.
Same thing. So when we combine the glycosome with the
SPF 50.
you get plus 8%.
Yeah. So, okay, I ask on behalf of, for example, I'm the audience, so I ask on behalf of all the audience, would I be able to combine with UVA sunscreen as well? Because you are more focusing on the UVB.
Yes. So when we did the experiments, the challenge that we used in the experiment was UVB by itself. But in the actual product, the total formula does have the full UVA protection capability.
Or you have UVA protection in the product.
Yes.
In
That's
that
right.
pink bottle,
Yes.
you got UVA protection as well?
Yes.
By what? By do you have?
4 pluses.
I mean, which agent that you incorporate in that?
So for the UVA, we have the UV filters in there that does that job.
Okay. And what about this graph?
Is like a quick summary of the clinical results. So from the previous chart, you see the results of the glycosome in the skin model, in the ex vivo skins, in vitro, and now we come to the clinical results. So this is the 12-week clinical test of the Thai consumers, right? I just want to kind of highlight that point again, because as Dr. Wasnov was saying earlier, that treating the melasma condition in Asian skin is extremely difficult.
Yeah.
Right.
You know
So-
what? Actually, I can't believe that this product can did a good job like this until I have a chance to see many study subjects in the trial. They have the picture like this, really. So this is quite interesting. Yeah. But how can we use these two products, the left one, or we should do the right one? How do you recommend?
So the left one's got the SPF and PA4 plus capability.
So we use in the morning.
In the morning would be recommended. Correct.
Okay. And what about the right one?
Can
The right
use
side?
At night or in the morning.
At
as well.
night? Or we do apply the right side twice a day?
Can combine.
Can
yeah.
combine?
Yes.
Okay.
And then next part is the second leg of the Vaseline Proderma face care range. So
Okay.
the first one is about melasmas, right? Sun-induced melasma. The second one is about strengthened skin barrier or the
Okay.
barrier repair.
It's time to rescue your skin barrier. New Vaseline Face Care for Barrier Repair with proprietary glycosome and ectoin increases barrier strength by 33% for resilient and hydrated skin. New Vaseline Proderma Barrier Repair.
Once again, so similarly to what we've seen in the melasma repair range, right, the four-step approach. For the barrier repair, the product also does the three-step approach as well. So once again, the number one most important thing is about neutralizing the free radical. So when you get rid of the triggering mechanisms, right, all other goodies will come along naturally. Right?
Okay.
So that's number one there. The second part is about strengthen the skin barrier from within. So this is the part about glycosome.
That
Restore,
boosts up
rebuild
the
their
ceramide.
That's correct. And the last bit is the part of the glycosome technology also help natural synthesis of the hyaluronic acid inside the skin as well.
Okay, endogenous HA production. So in the products, you don't incorporate HA, but
That's correct.
glycosome can
That's correct.
induce your skin cells.
Yes. Yes. If you look
To
at the
produce
glycosome cocktails, right?
Okay.
So the key ingredients in there is the acetylglucosamine. So that's considered the kind of pro-HA.
Acetylglucosamine.
That's correct.
Okay.
Quick results again, lots of chart, but I think the key point on these charts is that if you see the results, right, basically the glycosome technology help strengthen the skin barrier when you track that through three key different biomarkers like alpha-protein 3, HA binding protein, as well as the longest one. So, yep.
Okay.
This is another part of the kind of results. Once again, when you combine glycosome with the SPF protections, right, you get boosted benefits. So from the previous chart, you saw glycosome plus SPF with the benefits towards the melasma. This one is glycosome plus SPF with the benefit on skin barrier, right? And once again, you get plus 30% improvement or 2.5 times improvement when you combine glycosome with the SPF protection.
So the main concept is to like make the skin barrier stronger.
Yes.
And this is the key when we fix the melasma patient. So we as a doctor in this room, we are all doctors. So we don't want to just treat the excess pigment. And I think to restore the barrier is very, very important. Very important. Else the melasma can recur.
Again, this is the clinical result. It's a 4-week clinical results tested in the on Thai consumers, right? And you see that glycosome does deliver benefits in terms of strengthening skin barrier and providing the moisturization to the skin.
On the left one, you have UV
That's correct.
protection
Yes,
as well,
yes,
right?
Yes.
But on the right side, you recommend for nighttime or even
Yes.
daytime if
Yeah.
they have dry skin.
Yes.
But just wonder how long that it does work, I mean, in the skin. I remember there was one time that you introduce another products in the market, and that we apply just one time, and it can last for like more than a day.
Yep. So that's the.
What about this one?
72 hours longer lasting moisturization. For this one here, I think
Up to 24 hours after single application. So well, basically you apply just once a day is adequate.
And again, so that's the recap of
Yeah.
the Proderma range from
Yes.
last stream. The new product range, it's got 4 variants, 4 different products for us to choose from. We have the melasma serum and cream, as well as the barrier repair serum and creams as well.
Yeah, so I think people in this room are a bit confused already that which one they should go, right? For the pink one, I think if you have like hyperpigmentation problems, you should go for the pink one, right? And if you look at the little letters, you not only see the 4% glycosome, you see the niacglutamide.
Yep.
Can you elaborate more about the niacglutamide that you?
So that's pretty much the niacinamide. or the vitamin
Niacinamide
D3,
and
the precursor of the glutathione combined.
okay.
So basically, why we have that in there is that if you look at the pink range, we would like to actually boost the performance towards the pigmentation even
Okay.
more, right? So as you understand that we have different ingredients in the glycosome cocktail to address different kind of a portion of the melanogenesis pathway. But now we also add niacinamide in there. Just to prevent
Niacinamide
the
and
transfer.
glutathione
Precursor.
precursor. So that's why you have the complex called niacglutamide.
That's correct.
Okay, and this is your own technology as well.
It's the combination of both.
Okay, but on the blue, the differentiation is that you have ectoin.
Yeah. So on the blue part, because the blue part has been engineered to kind of focus a little bit more on the loss of moisturization.
And we know
barrier
that
damage.
ectoin can enhance the skin barriers
Yes.
function as well.
Yes.
So that's why you incorporate ectoin.
Yes.
Yeah. So if your patients don't have much pigment problem, they go with the blue. We can recommend them to go with the
Exactly.
blue, or
That's
even post laser, any lasers that we want to strengthen the barriers, we go with the blue.
Yes.
Yeah. But if patient have melasma, you go with the pink.
Yes. Yeah.
This is how we differentiate.
And I think that we brought that to a close for the face range.
Oh, not only you have body range as well. So this is for the face.
Just a quick reminder, right? The last bit of the kind of sessions, right? We also have Vaseline Proderma body care product range as well.
You mean the middle one, the bottle, the jar.
Yep. So
the
we
blue
have
jar.
three products in the range.
Okay.
So we have the pink one focusing on the brightening benefits. We have the green one focusing on the smooth of the skin, and
Okay.
then for the moisturizing benefits on the jar.
The jar, the blue jar. This
Yep.
is my favorite. The one
Yes.
that I mentioned
Yes.
that after I apply,
That's it.
and then it can
That's
last
the
for
one.
like 36 hours. I remember I apply because I am atopic patient. I have atopic dermatitis, and there was one time that I have to travel, and I have only 3 days, and I cannot do the check-in bag.
Yep.
So I have carry on bag only, and I cannot carry the blue jar because it's too big to carry on. And then I just apply before I leave home. And then when I come back home in the next 3 days, after I've been to the Europe, I said, oh, my skin is still okay.
Very good.
Then I don't have to bring the cream with me. But the green and the pink, so the green is for smoothening, right?
Yes,
Then
that's right.
what you incorporate the ingredient? What is the key ingredient of the green?
It's different combination of the hydroxy acids.
The
Just
what? The what?
Hydroxy acids.
Hydroxy acid.
So combination of different kind of a size of the hydroxy acid. So
Okay.
lactic acid, gluconic acids.
What? Lactic
ครับ
and
Ah.
what else?
Glycolic acid.
And glycolic acid.
ครับ So just
Polyhydroxy acid as
Yeah,
well?
yeah.
Okay, so you mixed everything together.
Yes.
And what about the pink? The bottle, the middle
yeah.
one?
Pink one, once again, it's got the niacinamide in there as the hero ingredient,
Okay,
working together with the proceramides technology. right?
Okay.
Proceramides is actually kind of the technology that came before glycosome,
Okay.
but it's still considered a bio precursor technology, right? Proceramide is essentially precursor of ceramides, just like we talked about. So it's in that as well.
Oh, and what about the, again, I'm just confused. What about the differentiation with the glycosome? Because glycosome also induce the ceramide
That's correct.
synthesis.
So glycosome is kind of the enhanced or souped up version of the proceramides. So
Because
basically
you have
it has the
additional
same-
benefit.
That's correct. That's right. Exactly.
Okay, okay,
Exactly.
I understand already. So this one, you incorporate pro-ceramide technology, so you boost your skin to produce many types of ceramide.
Yes.
But glycosome is more than that, beyond that, because
That's
you have
correct.
another
Yes.
activities,
Yes. So
not
it's-
only pro-ceramide
So,
boosting.
Yeah, the key ingredients that makes this one different from the glycosome is the fact that glycosome has the ability to neutralize free radicals,
Yeah.
get rid of the oxidative
Excess
stress.
fat, okay.
So that's the step up beyond the proceramides that we have in this product
I
range.
see, I see. Then can we apply the product that we already mentioned previously on the body?
Can
Right?
can definitely
But
can.
it's going to be more expensive.
Very expensive.
Oh, okay, I see.
I think that's
Okay. So are we finished with the presentation?
yes. I think so. But
So this is the last slide
Yeah, I
that you
think-
want to integrate.
Yes.
Yeah, but I think this is very interesting, and I think you handle the samples to the audience, right?
yes.
Yeah. So what in the back? I haven't seen yet. What inside the
so,
bag?
So in the bag, you will get the pink ones there. So
The pink
melasma
jar.
repair serum and cream packed with the glycosome technology. That's right. And the product comes in this unique, wonderful sensory when you apply on skin as well.
Okay, they got the pink samples.
Pink and this
And the
one.
body น้องเอ็กโคในถุงมีอะไรบ้างดูหน่อยสิหยิบถุงออกมาหน่อยสิ
The two pink ones and then
I let
the number
Dr.
4.
Echo show the
one in the
product.
jars. Yeah.
Two pink products and one jar.
Yeah.
Oh,
Your favorite.
the blue jar, my favorite one, right? Okay.
I think that's the end of the session.
Yes.
Now,
So you have we have 10 minutes for Q&A.
Yes.
If anyone have question, yeah, feel free to ask. I think just now I saw Nong Echo, Dr. Echo want to ask something, right? Can you come up to the microphone? ขอเปิดไมค์ให้หน่อยครับได้แล้ว
Hello. Okay. I have one question from the bottom that you refer to the glycosome. I saw that there's a two line that has a different ingredient. So can you elaborate more on that?
You mean the อันไหนนะล่างซ้ายล่าง
The
ข
two
วา
asterisk, yes. They have like in the left,
left side
right?
the blue side
No, from the asterisk ดอกจันข้างล่างเลยครับ
ดอกจันล่างขวา
Yes, the right.
You mean 3% glycosome complex? No.
Oh.
What he said is the right
yes,
side.
yes,
Oh.
the bottom.
Oh, okay. Refer
okay.
very small one. Refer
Yes.
to cysteine.
Yes.
Yes, why there's a different between the two asterisks? Okay.
So basically, these are kind of just a highlight on what the ingredients that goes into the glycosome cocktails. That's right. We have majority of the ingredients are the same. I think the one difference is perhaps the cysteine in this pink variant, but the rest of the product in there, it's got the 16 lysine carboxylic methyl cysteinate. So basically, it's a different form of cysteine that we have in a different product. That's it. But it's boiled down to the same thing. So both of them, when you apply on skin, it's the cysteine that delivers the benefits on the antioxidant, and then it delivers benefits towards the pigmentation pathway. Just the different kind of original form of the cysteine. That's it.
Actually, I just saw the things that you have in the pink jar. Pro-retinol. What is pro-retinol?
Provitamin A.
Yeah. So we know retinol.
Yes.
We know retinaldehyde.
Yep.
we know retinol palmitate.
Yes.
So these are like of many forms of vitamin A, and
Yes.
like retinol palmitate is quite, it's not irritate to the skin when compared to the retinol or retinoic acid, right? And what about proretinol?
So it's the retinol that we have in the product, just to help kind of with the collagen synthesis and help with the firm skin.
Okay.
That we have in the cream one now. Yeah.
All right, so I think we are pretty much covered with the topics that we want to deliver to the audience. So if you have more questions, you are feel free to ask outside the room or at the booth. Visit at the booth. I think you provide more information at the booth as well. Where is your booth?
It's up on the third floor.
Third floor, level 3.
Yeah.
Okay. So thank you very much for your attention. Oh, you have one more question? Okay, can. I think we have like another 3 to 5 minutes.
Yeah, I cannot reach the mic, I'm sorry. So I'm just wondering something on the graph because like
The graph?
Yeah, from the pink serum one, yeah, the melasma repair. Like I see the result from the first week to 12 week, which is like the result is like the drastically change of the result from the melasma, from the whitening, that part, yeah. I'm just wondering if like, yeah, all of the case from like 35 Thai female consumers, they just using this serum instead of like the sunscreen, or they have some combining routine as well?
Just this product alone.
Oh, just only this one,
That's right. That's right.
And they like applied it twice a day, or
Yes.
they reapply it during the day as well?
Twice a day. So we,
Okay, thank you.
So the serum with sunscreen,
Also
they
twi-
apply twice. You
That's
you
right.
let them apply
yes,
twice a day.
So we've asked them to apply each product twice a day for the period of 12 weeks for the clinical study.
Okay. So I think she wants to go back and apply already. All right. So I would like to thank you everyone and would like to close this session. Thank you very much for your
Thank you, Kap.
attention. ขอบคุณครับ